Hey guys, it's Sunny Goggin, and today we're going to talk about how you can get that back pain better. What are the strategies that have been shown by research to improve low back pain? Low back pain is one of those things that it takes people out of work all the time. So here's the article, Exercise Intervention for Patients with Chronic Low Back Pain. This is a systematic review and meta-analysis. So they looked at a whole bunch of studies. And let's talk about what they found. Well, basically, there were around 5,000 people in these studies, and they looked at studies that covered things like aerobic exercise, core exercises, manual therapy, McKenzie, all these different modalities, Tai Chi, stretching, Pilates, physical therapy, and then let's find out what they found, okay? Because it's always hard to distill things down in when you're looking at a ton of disparate studies, but there are a few big take-home points. Compared with conventional rehab, what they found was these are the things that reduce pain when you compare it to conventional rehab and physical therapy. Core exercises, McKenzie exercises, Pilates, Tai Chi, yoga, multimodal exercises, which is sort of poorly defined, but those are the big things. So Pilates, Tai Chi, yoga, McKenzie exercises, core work, these reduced pain compared with conventional rehabilitation, okay? But compared to no intervention at all, let's say you aren't going to the physical therapist at all, aerobic exercise, core stabilizing, home exercises, manual treatment, McKenzie, motor control exercises, muscle training, Pilates, sling exercises, stretching, water exercises, and education all reduce pain. So what this says is that you got some power, guys. And this is big. So if you can't go to PT, if you're too busy to go to PT, guys, YouTube is your friend. Bob and Brad's, go to Bob and Brad's, the most famous physical therapists on the internet. I refer people to them all the time. Bob and Brad, they're great. And so with regards to, so that's for pain. You could do just about anything to, start to get your body moving to reduce the pain. And that's one, it's scary when you have low back pain. You're like, I don't want to hurt it at all. It's going to make it worse. Turns out moving is going to make it better, okay? A lot of times we have to break a cycle of pain that is dysfunctional, pain that's not serving you. It's not telling you something's wrong anymore. It's happening because there's a feedback loop. And so that's why movement can help. But what about physical function and your strength and your ability to move? What they found was that compared with conventional rehab, core exercises and yoga increase physical function. Guys, yoga is all over. That's all over the place on the internet. And, I think when you're going to start yoga, the big thing I'd say is kind of start gradually. Also what they found is that compared with no intervention, if you're doing nada, core exercises, Pilates, stretching, yoga, and other exercises all increase physical function. All right. Now, these studies, they're disparate studies. The risk of bias in these was 19 was high, and in 56 of them, it was unclear about the risk of bias. But what I know as a functional medicine physician is that movement aids healing. It's almost like it sends a signal to your body, you're okay. And so I encourage you, if you're having low back pain, maybe start with stretching, gentle movement. Check out Bob and Brad's channel. Love those guys. And know that it can get better. Even chronic low back pain that's been there for a long time, I have seen get better. I've seen it fully go away. So movement, which should be a really big part of that. Of course, good nutrition. Sometimes foods can also inflame. If when you inflame your gut, you inflame the rest of your body, and it can make your back hurt more. Okay, and mindfulness-based techniques can also help with pain reduction. I love the Curable app. The Curable app is amazing for helping you rewire your brain so you're not getting as much pain. All right, guys. I hope that's helpful to you. Go ahead and hit that like, subscribe so that you can see my next video. And I hope you have a super duper day. Bye.